Begin with the urgent mandate for New York City municipal workers.
Here are the details. By September 13th, the entire workforce of the nation's biggest city must be vaccinated or face COVID testing every week. This new mandate applies to, among others, teachers, frontline workers, the NYPD, the FDNY, and all city agency workers. And by the way, vaccination rates in those groups all lower than the city's inoculation average.
Anyone who doesn't want the shot will be required to wear a mask indoors. And if they don't, they will not get paid.
And to make compliance easier, the city will soon unveil a new app to keep track of vaccination records and testing results. Needless to say, not everyone is happy with this new mandate as we see a new big surge in cases.
Eyewitness News reporter NJ Burkett is live in Lower Manhattan with our lead story. NJ?
That's right, Sade. Some unions are pushing back tonight. DC 37, as you know, the largest public sector union here in New York, says you can't mandate testing. The firefighters union says you can't mandate vaccination. Well, of course, this announcement all comes with the rising rate of COVID-19 infections and the dwindling rate of vaccinations.
The mandate will cover everyone who receives a paycheck from the city of New York. Either get vaccinated or wear a mask and get tested every week.
There unfortunately will have to be consequences because we have to take seriously if someone's unvaccinated. Unfortunately, they pose a threat to themselves, but they also have a greater chance of spreading the disease.
The goal, to have every New York City employee vaccinated for COVID-19 within the next 7 weeks. Everyone from police officers and firefighters to office workers, public school teachers, and hospital staff. 1 week from today, it's hospital and other healthcare workers. 2 weeks later, it's workers in residential and congregate settings like nursing homes. And by September 13th, the entire municipal workforce comes under the mandate.
If employees refuse to comply, they just can't be at work. And in fact, they will not be paid.
Tonight, some union leaders are pushing back.
The position of the UFA has always been pro-vaccine, but we stand firm that a non-FDA approved vaccination is a personal choice.
It all comes as the original COVID-19 virus has mutated into COVID-19 Delta. It spreads faster and is now the main source of infection in New York, even causing illnesses in a small percentage of fully vaccinated people.
Some of the steps that we're taking, starting with the city workforce, as we announced today, will also propel more people to get vaccinated in the coming days.
Public health authorities are hoping the business community follows suit, but it's not that simple.
Most employers are not going to be demanding vaccination until the FDA approves it, until the federal government basically says federal employees must be vaccinated. Some way to say to their employees, look, this is a federal public law or issue. We don't have a choice.
Well, to be clear, the vaccines have been given an emergency use authorization by the FDA. They have not yet been fully approved by the FDA. Some members of the business community and many of the unions say that matters. Although, of course, as we all know, the vaccines are widely effective and safe.